We are currently in the middle of tree pollen season now. So if you have allergies to tree pollen, some of the symptoms you will experience include runny nose, sneezing, itchy eyes, and watery eyes, as well as nasal congestion. So one way you can distinguish allergies from COVID-19 is that with allergies, you will not have fever. So you may have runny nose symptoms and watery eye symptoms, but you should not have fever.
The symptoms of coronavirus include fever, dry cough, shortness of breath, and sore throat. And one way that you may be able to distinguish a common cold from coronavirus is that the shortness of breath usually occurs later on, and you don't usually see that with common colds. Another thing you might find is if you do have asthma is you may have shortness of breath but with some wheezing because of an asthma exacerbation. And you can always try albuterol to see if that helps you with your shortness of breath.
If you have allergy symptoms, you can treat those symptoms with antihistamines that are taken by mouth, as well as antihistamines that can be given in the nose, as well as nasal steroids. There's also available antihistamine eye drops that you can use in the eyes for itchy and watery eyes. Another important treatment consideration is trying to limit exposure outdoors on very high pollen count days. So you should watch the news and also go to childrensmercy.org to look at the daily pollen counts. And on the days that the pollen counts are really high, you might consider limiting your activities outdoors, but certainly making sure that you keep the windows and doors shut in your home and also when you're riding in the car. There have been recent reports about concerns of steroids during COVID-19 infections, but those reports mainly deal with steroids that are taken by IV or by mouth that are called systemic steroids. It's important for you to continue taking your inhaled steroids daily because that will help to maintain your asthma in control.
You may have heard concerns about using your nebulizer machine in light of the COVID-19 infection. If you do suspect that you have COVID-19, the reason why people have these concerns is because using a nebulizer may increase the droplet spread in the air about 1 to 2 feet around the nebulization, but also for 1 to 2 hours afterwards. So if you have concerns that you actually have COVID-19, try to use an albuterol with a spacer. And if you can't, and you have to use an albuterol nebulized, then take it somewhere where the air doesn't recirculate in the home, such as in a garage or on the porch. That way, it can minimize the spread of the droplets. If you have any further questions or concerns about your asthma or allergy, please reach out to your asthma or allergy specialist with further questions. Otherwise, please feel free to visit the Children's Mercy website for further education on asthma and allergies.